2 times breathe. 30 compression, 2 times breathe. Now see here. Right? Now. If you found light here, it means that exactly we are applying 2 inches of pressure. That's a proper hand position is required. Now 30 compression is completed. Then 2 times breathe. CAB, remember the word CAB. C for compression. Then A for airway. B for breathe. Better to check the pulse, sir. After 30 compression, better to check the pulse. Is there any pulse? Stop the compression. Okay? Now, generally, while giving breathing, mouth to mouth breathing is acceptable. But post-COVID it's difficult now. How can I give directly mouth to mouth? If you have such a hesitation, take a cloth, kerchief, mask, even tissue is also not an issue. Right? Take the tissue. Now single layer. One more important. The 2 conditions while giving breathing. One is chin up. Second important, while giving breathing, you must close the nose. Otherwise, while giving breathing from the mouth, that may come through the nose. Chin up, close the nose, 2 times breathe. After 2 breathe, again come to compression. See here, compression. Compression, breathing. Compression, breathing. Remember, for a single person, it's difficult. You can't do more than 10 minutes like a kneel down position. That's why we need to take help from the others. If 2 persons are there, one go with the compression, other go with the breathing. Simultaneously they can interchange. Right? Now, hand position is different for different age groups. This is more than 8 years. For infant babies, exactly middle of the chest, 2 fingers. 2 fingers are 2 thumbs. For infant babies. The ratio is 15:1:5 for infant babies. 15:1:5. 15 times compression, 2 times breathe. Age 1 to 8, single hand. Single hand. The ratio is 30:2. Okay. Now, generally have such kind of hesitation for unknown person. How can I give breathe even though if you use tissue or something? If you have such a hesitation, the new concept in CPR is hands only CPR. Hands only CPR means continuous compression is also fine. How can I give breath to another person? I don't want to give the breath, but I want to save the life. Go for continuous compression without any break. Without any break, continuous compression is also fine. That is called hands only CPR. That is the new concept in CPR process. Now, what is the reason for sudden cardiac arrest? Electrical. Inside electrical system is failure. That's why the person suddenly collapse. No response, no breathing, no pulse. That's why some cases the body get some cool also. That's why observe most of the people try to rub the palm, rub the heel to generate heat to the body. But that heat is not sufficient. Immediately some shock is required. To give a shock, we have a machine called AED. We have a AED in all respective floors. AED. What is AED? Automated external defibrillator. Simply we call it as defibrillator also. Okay, how it will work? If you have AED, use the AED. If you don't have AED, only option is CPR. 30 compression, 2 times breathe. 30 compression, 2 times breathe. If you don't want to use the breathe, continuous compression is also fine. If you have AED, once you brought the AED to the place, then what is the problem? This AED has battery, chargeable battery.